Okay, welcome back everybody to the second session, which is looking at how we develop a framework for ongoing sustainable collaboration. So this session will look at opportunities across member states and the European Union as a way of supporting action to reduce health inequalities. And as you heard from the Minister from the Welsh Government earlier, we're going to cover two of the four work packages from the programme. The one on subnational action at regional level and the one on engagement of stakeholders. We're not just using these sessions to share findings from the panels, but again we're trying to look ahead in terms of how these findings can continue in terms of informing our work. The stakeholder work package 7, has been led by BZGA, the Federal Centre of Health Education in Germany, and OEFI, the National Health Institute in Hungary. And the regional work package 5, has been led by EuroHealthNet. And it is therefore my pleasure to introduce Clive Needle, the Director of EuroHealthNet, who will be moderating these first two panels. Over to you, Clive.
John, thank you very much indeed. Good morning, everyone. Welcome back to the second session. And you'll be delighted already to see that as gender equity is an important part of the work on health inequalities and social determinants, we're going to welcome three excellent women speakers to our panel to follow the excellent male speakers we had in the first session. I'm sorry I'm the token male on this panel, but I would just briefly introduce, as we are short of time, but do plan ahead in two ways. First of all, at least one of our speakers will not be speaking in English, so do get your headphones ready if you need to understand Spanish in particular. And secondly, do be ready with any points or questions, because we're very keen to allow as much time as we possibly can. I can make a commitment at the start on the basis EuroHealthNet has been very pleased to support the work of Equity Action, congratulates the organisers not only on this event but on 3 years of really hard work. And we can announce the launch in 2014 of a new platform for health and social equity to make sure that none of its learning will fall away and not be taken up in future. And every single person in this room, and yes, you out there on Twitter and web streams as well, can actually be part of it. So do talk to us. We will be happy to engage you, whether you're from any of the stakeholders on a fascinating list of participants here, from business community, from local and regional municipal authorities, right their way up to international bodies and national governments. Do come and talk with us. We will try and make sure that the work of Michael Marmot and others is taken forward. Now, to help us take forward this process this morning, we're building on the work of the work package, which has engaged already many stakeholders, and we have three excellent perspectives from there. The work included stakeholder dialogues and a range of fact sheets, and you can find out all about the work that the people leading this package have put together at the Equity Action stand. So do please go there, take the information or follow it up in the excellent web portal and website that has been produced with all the information online. Now let's hear from our three panellists to stimulate the discussion on the detail of what can be done, a can-do approach today. And I'm delighted, first of all, to be able to introduce Ireland's first ever Minister for Children and Youth Affairs, who was appointed in 2011, and as you can see from the biography packs you have, has a long record of distinguished work in these fields. May I welcome this morning Minister Frances Fitzgerald.
Thank you. Thank you very much. Good morning, everyone, and thank you for the invitation to be part of this very important conference. As Ireland's First Minister for Children and Youth Affairs, I have a very deep interest in this topic, which is, of course, critical for all our countries. Ireland has one of the youngest populations in Europe, with nearly 40% of our population under 25 and a quarter under 18. Our population of 0 to 4-year-olds, in fact, has increased by over a third, in contrast to many countries, since 2001. So our increasing child and youth population is a significant resource for our country. Our younger generations are our future. Ensuring their good health is vital to our national interest. It's vital for the children themselves, but it's also vital for our future, our economy. In his seminal report on reducing inequalities in health, Fair Society, Healthy Lives, Professor Marmot, whom you've heard this morning, and his colleagues state that giving every child the best start in life is our highest priority recommendation. Now, I know that Professor Marmot, when he was speaking earlier, made a comment about politicians and children and that there should be an open door, and he may be right on that to a degree, but certainly in terms of implementation, this whole question of stakeholder involvement and working cross-sectorally is absolutely essential if we are not just to pay lip service to children, but we are actually to get health policies implemented that will really make a difference to children. Much of our research, not just in Ireland but in Europe, does point to an appalling vista for a proportion of our children. In Ireland, many of our children are doing well, but a significant minority are not. We have invested considerable amounts, 35 million in the last few years, in terms of becoming data rich about our own Irish children. And what we are finding from that longitudinal study is that for many children, we have a very serious issue, for example, in relation to obesity. We share this with other countries. I don't need, in this audience of public health specialists, to point out the implications of that or the lifestyles which many of our children at this point are adopting and the consequences of that. In Ireland, the consequences of it are that 25% of our 3-year-olds and our 9-year-olds are obese or overweight. A very worrying trend, and it does pose very significant challenges for the future health of the Irish population, in particular obviously with respect to the emergence of non-communicable diseases, diabetes and all of the other health factors. We have very strong evidence at present as well about continuities in health. More and more we know that if our young children at 3 have health issues, that there is a very real risk that they will continue into adult life. Very high statistics, for example, in relation to obesity and continuation into adult life. So let me take that as an example in what we're doing in Ireland. And how do you get that cross-sectoral response that is needed if we are to tackle this issue effectively? No one department is going to tackle this challenge, that's for sure. And the key theme of this session is how do we mobilise many stakeholders, how do we engage many players, and how do we change behaviour at population level. Collaboration is critical, and we say that very easily, obviously very often. But my experience would be that working cross-departmentally in government does require changes of attitudes. It does mean moving from a silo mentality. It does need government departments thinking about new ways of engaging with one another, because there are many traditions that persist in departments about how you work. So we have to be innovative and creative across government departments. Equally, at political level, I think it's extremely important that political manifestos and politicians are increasingly aware of health inequalities, and various actions are taken to make sure that the very rich data, for example, that we have from all of our researchers is very well known to politicians, because that will make a difference as well. And one cannot assume that what is very familiar to people in this room is as familiar to those who are making the policy decisions, whether at government level or within civil service. We have to involve business. We have to involve public awareness. We have to involve the media. We have to think about NGOs, sporting organisations, and we have to think about children themselves and their involvement. And I'd like to make some comments about that later on. Collaboration doesn't happen by accident. So how do you get collaboration? Well, collaboration needs leadership. There's no question of that. So a plan is needed. If I give you an example in Ireland, the collaboration and planning in relation to health has resulted in a document, which is the Healthy Ireland document, which is very much based on stakeholder involvement and collaboration across the sectors that I have spoken about, so that we can track progress and see who is doing what in tackling these health inequalities. For example, again, on the obesity, the Department of Health, Department of Children have launched a very high-profile 3-year childhood obesity campaign called Let's Take It On, One Small Step at a Time. We now have high-profile advertising targeted at parents, which is getting a very strong reaction in the country, because this information that a quarter of 3-year-olds are obese or overweight has actually come as a shock to people. Not to people in this room, but to the general population. It's quite shocking to think that a quarter of 3-year-olds could be obese. And this advertising campaign is building on that. It's generating awareness amongst parents about their shopping habits and about the threats caused to their children. And of course, parents react when we are talking about child safety. So that's targeted at parents and involving parents and using media. We're doing all of the obvious things in relation to calorie posting and healthy food products and vending machines. Of course, this does mean taking industry on. As soon as you raise what's in the vending machine in a school, you have a very interesting reaction from those who are supplying the vending machines, and quite an interesting debate. It's not taken for granted at all that there should be healthy food in vending machines in school. That's a topic in itself. You can also look at the question of fast food outlets near schools. At my instigation recently, we've asked the Minister for the Environment to ban fast food outlets near schools. And just this week, McDonald's were refused planning permission to open a fast food outlet beside a school. That needs the cooperation of local authority, planning authorities, environment, and indeed in that instance, young children and the principals in the school ran the campaign themselves, which I think is a very interesting initiative to see children getting involved in that type of campaign. I think that equally our local authorities, a national play and recreation policy is very important, involving all local authorities in initiating greater awareness about play and recreation and making more facilities available. So many actions by many stakeholders are necessary to begin to deal with that huge health inequality that we're seeing in that area. I mentioned research, and I think every country must be data-rich about their children. And then that data richness needs to be incorporated into policy and into thinking at government level. And that data must guide actions on health and on the issues we're discussing today. The Departments of Social Protection and Social Welfare must have the data that we have about our children readily available and incorporated into their policies, to give but just one example. Equally, early intervention. I think the mantra of prevention and early intervention is absolutely critical. Bringing in, for example, free GP care to children under 6, which we are doing at present, is another way of dealing with that. I'll conclude by saying that I think listening to children and hearing the voices of young children is absolutely important in developing our health policies. I give one very small example. There's an international study that's done around 47 countries on a 4-year academic cycle, the Health and Social Behaviour Study. For the first time, I think, in any country, we asked children what they would like to see included in that health questionnaire. And it was very interesting what the 8 and 12-year-olds came up with and the 13 to 18-year-olds came up. They came up with themes that had not previously been in that study: independence, diversity, cyberbullying, a number of others. They identified, they felt they were important, those issues were important to their future well-being. I hope I've given you some indication of the range of issues and the range of stakeholders who need to be involved if we are to begin to move forward on tackling health inequalities. Thank you very much indeed.
Minister, thank you very much indeed, and we appreciate your brevity and how concise you were given the time. Given those constraints, I'm going to move straight on to our next speaker, but we will, after all three have made an introduction, give you an opportunity to come back with any comments, observations to raise with our panel. And I'm very pleased next to welcome Peggy Maguire. Peggy has been elected this year to be the President of the European Public Health Alliance for NGOs. And I'm delighted to say I've known her for many years. She was a child when she first met me, but has taught me an enormous amount, particularly about women's health, as the Director General of the European Institute of Women's Health. And we're very delighted to welcome you today, Peggy.
Thank you, Clive. Talking this morning about the excluded and how we can get them involved as stakeholders and hear their voices. Well, a lot of research has been done over the last 20 years on health inequalities and also on the excluded in society. Well, who are these excluded groups in society? There are myriad groups. They are the vulnerable, the unemployed, the mentally ill, the elderly, children, and people who are disabled or suffering from chronic diseases and can't get access to services. What causes these inequalities? They're myriad. They're structural at a governmental or macroeconomic level, but most of them come from lack of income, lack of access to education and lack of opportunities in life. So a lot of these people are living in poverty, and living in poverty combined with other vulnerabilities such as childhood and old age can exacerbate health inequalities. And as the Minister has said, childhood inequalities and ill health is a huge issue when it comes to equity in health. And I can give you one concrete example that EFA has highlighted over the last couple of months, in that in Brussels only 6% of Roma children are vaccinated. That's just one small issue in relation to health inequalities and children. And that is the reason why the European Public Health Alliance is calling for a child health strategy in the future, and hopefully we will get some support on that. Another issue, and as this is European Cervical Cancer Prevention Week, 13,000 women die every year from cancer that can be prevented, but there are thousands of women throughout the EU that cannot access screening programmes and help prevent cancer and save their lives. So these are just some of the issues and some concrete examples of what is happening at a European level. So how can we engage the excluded as stakeholders and hear their voices? Well, if we look at the NGO sector, and I can talk from the European Public Health Alliance perspective initially, NGOs are sometimes the only voice for the excluded and the disenfranchised in society. They are the only voice that can talk to politicians and have the capacity to do so. And that is the reason why the European Public Health Alliance, as part of its programme, helps to mentor, educate and inform different groups throughout Europe on how to engage with policymakers. This is not a natural thing to take up for a lot of groups. It can be alien to them to work with politicians to try and engage and influence policy. But also the European Public Health Alliance believes in a broader approach to health. As we know, most of the factors that influence health lie outside the health sector, such as housing, environment, education, etc. So in the mentoring programmes, we like to show and demonstrate to the different groups throughout Europe that you must engage with other policy areas as well. And it's important then that this continues over the next coming years. But unfortunately, a lot of NGOs don't get recognised for the work that they're doing, or money isn't invested also in the work. At a structural level, we have to look at what are the issues in relation to implementing, for example, health in all policies. We've talked for the last 30 years of the necessity for health in all policy, but there has been meagre progress. How are we going to get this achieved in the future? As the Minister said, unless we have very strong, committed leadership from the very top, this is never going to happen. We have examples, as we were given this morning in the Health Equity project, as to how that can happen, but we need to disseminate these models of good practice as widely as possible. This doesn't always happen. And if we are to have an integrated approach in the future, we have to engage people in the policy debate and decision-making process. If policymakers are serious in making the citizen the centre of policy making in the future, they have to develop policies and design programmes and services that meet the needs of individuals, regardless of what circumstances they're living in. This doesn't always happen. And on the other side of the divide, not all public sector workers have the ability to engage with the excluded and the disenfranchised. So there may be the necessity to train or upskill people so they can actually deal effectively, collaborate and enable the stakeholder to engage in either directly or indirectly in their own decision making for their own health. I'd probably just like to end by saying that, and as the Minister said, we have the evidence base. The research is there, the evidence base is clear. We don't really need any more research on what are the causes of health inequalities, who are the excluded groups in society. I think what is demonstrated now in the Equity Action Project is that now we need action, we need implementation. And the European Public Health Alliance, in its manifesto for the European elections this year, are calling on all the future MEPs that are elected and come back in September 2014 to place people's health as a priority on the political agenda, to have social cohesion and sustainable communities, which means that we must have health in all policies. We must engage communities and stakeholders in the policy making and the decision making process. Thank you very much.
Thank you again, Peggy, and much appreciated, ranging over very wide, important subjects very concisely. Thank you again. I'm sure you've stimulated lots of questions and responses. Our next speaker will show you a couple of slides. I'm delighted to be able to welcome a representative from Spain because, of course, Spain did prioritise this as a presidency issue during their last presidency of the European Union. Unfortunately, their major conference was interrupted by a volcano in Iceland, which meant that the conference had to be cancelled, I think, because people couldn't actually fly there. So we're delighted to actually get Spain to a table at the European Union level to speak about health inequalities, and who better to represent that view than Ms. Pilar Farjas, who's been an occupational physician, national health doctor, and is now State Secretary of Health, Social Services and Equality. Pilar, you're very welcome.
Buenos días. Good morning. And thank you very much, Clive. It's a pleasure to be able to take part in this final conference on joint action for equity, which has been coordinated by the United Kingdom, and we'd like to thank them very much for leading that process. Spain has been actively participating in the panels for joint equity. We looked at tools, how we could improve the focus on health policy in cross-cutting policy, and we also wanted to make sure that we could get as many interest groups involved as possible. Today I'm going to be telling you about our experiences. I want to tell you about our methodology to promote participation in our second National Strategic Plan for Childhood and Adolescence, which will run from 2013 to 2016, as part of our joint action for equity. The aim of our National Strategic Plan for Childhood and Adolescence is to promote the well-being of children and adolescents, taking into consideration their needs and interests in order to increase their quality of life and foster the full development of their capabilities as active subjects. Our strategic plan was first developed in 2009 until 2006 to 2009, and then it was extended to 2010. In 2011, we then started planning for the next part, which would start in 2013. The strategic key to our plan is the Childhood Observatory. It plays an extremely important role for drawing up the plans for participation and planning. The Childhood Observatory in 1999 was set up as a working group in the Ministry of Health, Social Services and Equality, and it made it possible to bring in other sectoral ministry, territorial organizations and non-governmental organizations. It also has had the input from universities and local authorities. Here you can see the process through which we have developed stakeholder engagement and how they have been involved in drawing up the plan. Our National Strategic Plan is designed to be a framework for cooperation between all the different governmental, local and regional authorities. And we also want to engage NGOs and institutions which have played an active role, such as social associations and universities. In particular, I'd like to show you the 3 seminars that we had in order to make this coordination process easier. First of all, we had one on social inequalities and childhood poverty, and you can see the other 2 listed up there. Here you can see the key elements of our second plan. We started by making sure we had an updated and complete picture about the situation in Spain, so that then we would be able to draw up appropriate strategies. The second part was to put aside a specific budget for our PENIA 2 program, which it could use for its actions. PENIA 2 has improved the active participation of all actors and coordinated stakeholders. And of course, participation and coordination were the main points in this second plan. We had equity as a cross-cutting principle, and that applied also to health and other areas such as education. That's where we drew up specific work plans. All of these points were raised in the seminar that we held on childhood poverty and social inequalities. We wanted to make sure that we would draw up a plan which corresponded to all of the criteria. We wanted to have participation, an intersectoral approach, and here you can see then the 4 main axes that we wanted to follow up on. First of all, we wanted to improve all of the intersectoral activities as part of health promotion and prevention. We wanted to encourage a healthy lifestyle. We wanted to improve our care for small children and help people choose a more healthy life. Secondly, we wanted people to choose a more healthy lifestyle in pregnancy and postpartum. Thirdly, we wanted to improve comprehensive cancer care for children. This was part of our Spanish strategy to combat cancer. Our 4th axis was to have a more human approach in neonatal intensive care units, and this included skin-to-skin contact. So here you can see the key points. We had participation, intersectoriality and coordination. Thank you.
Pilar, thank you very much indeed. Thanks to all 3 introductory panellists. So you see it can be done. The examples in Spain, practicality, the examples from the Public Health Alliance and the work of NGOs in communities, and the work in Ireland and the approach with multiple stakeholders. Now, over to you, folks. I know many of you. I know you're burning to tell us the good things you're doing. You see the questions in your agendas. So who are the key stakeholders who must be engaged from your experience? What works well? What are the barriers that have to be overcome? But let's focus on the positives where we can. What is the added value? What does health have to offer to other sectors for intersectoral and multi-sectoral working? And how can we stop people working in silos, if at all? Just show your hands and I'll bring as many people in as I can for short introductions. At the back there, sir, there's one there. Come to me or I'm going to come to you, folks. You know how I chair these things. I'll ask you questions.
I thought Peggy Maguire hit the nail on the head talking about we have health in all policies, but how do we actually get that into action? And I thought Pilar Farjas, and I apologise if I've missaid your name, did a very good job of actually showing how in practice it can be done around a particular theme. I still think there's a question for us, which is, do we need special people who can work between the ministries? Their job is not to be a Ministry of Health, not to be Department of Education, but to somehow be in between the two bits to try and work and see what the opportunities might be.
Good question. Thank you. You didn't tell us, but that was Chris Brooks, who's one of the organisers of Equity Action. I'm not going to keep calling all English male people, but I'm going to call another one now. But I'd like some other people from different genders and nationalities, please. Robin, please. And then...
Robin Allen, yes. Sorry to be male. Yeah, thanks very much, Clive. I just wanted to follow on from what Francis Fitzgerald said, and I was delighted to hear about the importance of listening to young people. We're, as a health equalities group in Liverpool, we're working with children in care, with looked after children. One of the things that we found a really disenfranchised, disadvantaged group, and what we found is incredibly important, is their voice and listening to what they say and their experience. So, in fact, that follows on what you said about more male speakers, Clive. You know, I want to hear what young people say, not what I say about their health. I want to hear their views. Thanks.
Thank you very much indeed, Robin. Yes, please.
I think I would echo this one. Where are the young people in this room? I mean, the under 18s.
Who are you? Can you tell us who you are?
the European Alliance for Initiatives of Applied Anthroposophy, and working on a Swiss conference on child participation.
Okay. So can you just spare, just share some of your knowledge on it? What would you do to empower and engage younger people to be part of this at a European Union level? There are specific networks and organisations that involve young people.
Yeah.
So, what more should be done?
What I feel is that it seems to be quite difficult to have the different languages. You have those people that are engaged in child participation for ages, and then the ones that don't know. So how could they find a way to combine their knowledge and then have them speak here and have the children bring their experience into these kinds of settings? It's not easy, but I think it can be done.
Thank you. Let me go to the panel, if I can now, for any immediate responses for that. Do we need special people, interlocutors or other people to help facilitate this work across borders? How do we get younger people engaged better? How do we hear the voices from younger people? Pilar?
Well, I was saying in my presentation, in drawing out the plan, the National Plan for Childhood and Adolescence, one instrument was essentially Observatory for Childhood in Spain. So I think we can create structures for participation that are well organized and officialized, and that will allow a platform, precisely this platform of coordination and work among institutions, ministries in the various sectors, but also on a vertical point of view with local administrations, regional administrations, and national administrations. And indeed, more than 50 organizations, non-governmental organizations, are working in childhood and took part in drawing up the plan. So organizational structures, such as in Spain, observatories for overweight people, for example, within the strategy of prevention of overweight phenomenon in childhood, and the national health system actions aimed at stopping violence against women, just examples of structured organizations.
Children and young people's participation is a very interesting one. I think, first of all, you have to have it as a goal. I don't think enough governments have it as a goal, enough departments have it as a goal. And then I think you have to invent the mechanisms to make it happen. And so I think, mechanisms for children and young people's participation can be set up quite easily, but you do have to resource it. You do have to put someone in charge of it, and you do have to go out and link with those places where young people are, the youth organisations. They're out there meeting anyway, but it's very often a question of building the bridges between the formal structures and the young people. I would say that some of the most innovative things that are happening in Ireland, for example, in relation to mental health, are happening because young people are involved and young people are thinking about mental health, and they're breaking the stigma associated with mental health issues in a way that adults have found very difficult. So I think there's tremendous rewards for linking and creating different ways of participating. In my own department, we have a particular unit, a particular section who work on this all the time. So whatever policies we're developing, at the same time we have a participation and engagement with young people around those policies, and I think that's certainly one way you can do it. In terms of the first question, and how do you create this collaboration, obviously, I think you do have to lift it out of departments, if you like. You do have to have an overarching mechanism. I mean, that can vary. I think very often in Ireland we use a cabinet subcommittee where quite a number of departments are working together, reporting to a cabinet subcommittee on these issues, for example, the obesity issue I mentioned, and chaired by the Taoiseach. So I think you have to lift it to that level. But at a more micro level, I do think that you do have to create those mechanisms. And as I said when I was speaking, I don't think they're as easy as perhaps in this room we might assume they are sometimes, to actually work cross-departmentally, because there are very well-established ways of working. And even bringing ministers together cross-departmentally on particular topics does need a driver. There's no question of that. You need a driver, and you have to identify that driver. It may well be in a Department of Health, as we've seen in some of our policies. You need a driver, and I think it is very often on the public health side.
Thank you very much. Peggy, did you? Yes?
Yeah, I concur with what the Minister said, yes. I think what we're really talking about, again, I think Michael Marmon said it this morning as well, we're looking for a creative and innovative leadership from the top. We've been talking for years, and there's been a mishmash of talking at interdepartmental level, but it's not happening. It's only meagre. So what we need is an innovative leadership that has a good focus, that has a vision for the future with a proper manifesto for interlocking and integrating these departments, with a budget, and also prepared to give the skills to the frontliners, to the front line in services that are going to meet with the stakeholders, because it definitely won't be the cabinet of governments that meet with them. How do we involve young people and stakeholders in general? It's not easy. Because not all of them will have the capacity or the capabilities to actually engage, and that's a huge issue that we have to address in the first instance. In other words, support the NGOs that are out there already. From the European Public Health Alliance perspective, and also as my day job in the European Institute of Women's Health, we do engage with young people. We find that young people want to be part of the decision-making process. It's just that they aren't taken seriously enough, and they're not allowed to have a voice. And a very practical example of that is from an Irish perspective as well, in that the national screening programme there brought a whole load of stakeholders together to talk about what type of screening programme is appropriate for the population base in Ireland. And as part of that group, there were the disenfranchised, there were the Roma, the travellers, but also young people as well, young women, so that they could give their voice as to what we think is the best way to communicate with us. We are not just targets, we are agents, and I think that is the problem. We have to see the disenfranchised youth, different population groups, not as targets, but as agents for change, for agents for their own health. And I think if we can get into that mindset of looking at people as their own agents, I think it's a different way of looking at getting stakeholders involved. They're not targets, but also agents.
Thank you, Peggy, and thank all three. I'm just going to give you notice. I'm coming back to you in a second for your final take-home messages for everybody, a very quick one. Can you just bear in mind, we're getting a little bit of feedback from Twitter, and there's a question come up which I think relates to what you began to talk about, Peggy, but it's a much wider subject in terms of migration, people moving across borders, transient communities, often struggling to get access to services, not only healthcare, but on a wider basis. Of course, working at an EU level, there are important considerations there that we can work on. So if you have any concluding comments on that. But if I can add to the question to the panel, because the last of the question is about the added value that health has to offer. In the member state with which I'm most familiar, there's a new initiative to offer free school meals to primary school children. And last week I saw evidence in the pilots that actually that is improving educational performance. The Schools Health Network, I don't think Hofbeuys and coordinators are here today, but they've just literally issued a statement over the past week regarding the link between inequalities and social determinants. So I think that fits with what you've been saying about youth interlocutors and people who are working in communities, and perhaps that's how we can bring people together. But I think each of you have raised important issues that can be built on at a European level to support what is happening in national partnerships there. And if you want to reflect on any of that in your closing statements, please do. But otherwise, you have 30 seconds each for any concluding message to this distinguished audience before we hand over. Who shall I start with? Pilar.
Muchísimas gracias. Thank you very much. Well, I think the most important conclusion that we can draw is that in all equity policies, that we need that political willpower so that they'll actually be implemented. We need to encourage participation. We need to make sure people know about the real situation, especially the communities who are most vulnerable. For instance, in Spain, with traveling communities, when we have measures for children, they need to be targeted as well, because it doesn't matter about their actual status. And we also then need to evaluate what we're doing to check that it's correct. Those are the conclusions that we drew from our national plan. Thank you.
Just to conclude, I think if we want to have a future, Europe in the future that we are all very proud of, I think we have to work at all levels, at European, national, regional and community level. The community level is so important for the health of any population group, particularly the excluded and the disenfranchised, because if we have a strong, cohesive community with sustainable policies in transport, in education, in housing and good nutrition, we will have a healthy workforce, and therefore health will add value to the economy, because we'll have healthy workers who won't be out of work, etc. But I think we should end by saying we should have growth for health, not health for growth. Thank you.
Yes. I mean, the key message really is that you can make a difference. And, you know, we have such good information on the health side. And really, there are such optimistic messages there, in fact, if you do the right thing. And just the benefits for the individual, for parenting, for society, and of course economically, which is extremely attractive. If we do not intervene, if we do not get these public health messages across and really integrate it into our policies and our actions, then, you know, the implications for the future of Europe are very stark for the next generation, and particularly for that minority of perhaps 25%, which isn't such a minority, particularly of our children, who, if we don't interrupt, are going to face huge health inequalities as they go forward. And our states are going to face enormous costs in trying to deal with the very issues we're talking about today.
Very good. Thank you very much indeed to all of you. Thanks. I'm sorry it's so short and sweet, but we're going to move on to one of the other work packages. But I hope that you all feel inspired and take home something, because we can all do something. We can all do something more. We can all do something better, whether it's in states, communities, or European Union or WHO level. I think there were messages from each of our speakers about how we can engage stakeholders better. And with, again, thanks to all the people who worked so hard on the Equity Action Package for the past 3 years, can I conclude this session and ask you to thank all three of our panelist speakers. Thank you very much.